3 minutes earlier. That's pretty good. All right, William, please go ahead.
Okay. So thank you for everyone who's being present in the Zoom meeting. We're starting the Zoom phase of the 8th International Colloquium on Bioethics, Neuroethics, and AI Ethics. And on our first day, we start with the lecture of Professor Julian Savulescu. Professor Julian Savulescu is a professor in medical ethics at the National University of Singapore, where he directs the Center for Biomedical Ethics. He's also the director of the Oxford Uehiro Center for Practical Ethics and a professor of practical ethics in the same center. He's also a fellow in St. Cross College. So, Professor Savulescu, the floor is yours.
Thanks very much, James. I'm very sorry I have to appear by Zoom, but it's a great pleasure for me to be here. Can you see my screen?
Yes. Yes.
Okay, great. Let me see if I can make this a little bit bigger. That should be big enough anyway. Okay, so I want to talk to you about the concept of mandatory moral bioenhancement. So some of you may be familiar with the idea of moral enhancement. In 2008, together with Tom Douglas and Ingemar Persson, I introduced the idea of moral bioenhancement, which is the use of biological interventions such as drugs or surgical devices or gene editing or other means of changing our biology to make us more moral. And in 2012, I wrote this book with Ingemar that argued over 12 years ago that human beings were unfit for the future, that despite our exponentially increasing technological progress through industry and computing and now artificial intelligence, we still have essentially the same moral limitations as our hunter-gatherer ancestors. A disposition to violence, a tendency to be tribal, tendency to free ride when not observed, bias towards the near future, nepotism, and so on. And unfortunately, all of the events since we wrote this book have reinforced the pessimistic picture we gave of the future of humanity. We argued that there's the combination of increasingly powerful technology, human moral limitation, and globalization place us in a triangle of despair and bleakness for the future. And we argued that one way of addressing these limitations would be to improve human beings. This century, we face a number of existential risks: nuclear war, biological war or biological mishap, runaway artificial intelligence, climate change. And the cause of all of these risks is is the result of human behavior. And the human animal is the elephant in the room, and that if we could improve human beings, then we would have a greater chance of surviving this century. So one of the objections to this proposal, well, two of the objections. Firstly, one was that, well, in order for bioenhancement to be effective, it would have to be mandatory, because the people who are already the most moral would voluntarily choose to be more moral, and those who are immoral and at greater risk to humanity, psychopaths and so on. Psychopaths constitute 1% of the world's population, would not choose to take a moral bioenhancement. So it would have to be forced upon people to be effective. And if moral enhancement occurred, particularly by mandatory means, it would no longer be truly a moral enhancement. It would be essentially turning human beings into slaves. So I had this idea a number of years ago that we could look at parallels outside of moral dialogue for instruction on answering these questions. And I thought we could look to public health ethics because as Henry Sidgwick, the British philosopher, said in the 1800s, there is a dualism of practical reason. Humans always have a self-interest, and the demands of morality can compete with this. And there is a conflict between the individual and the group. This is present in distributive justice, but dominates debates in public health ethics. And in fact, vaccination has been described as a bioenhancement. And so my idea was, well, we could look to what principles we can derive from public health for when coercion is justified in imposing bioenhancements, not just vaccination, but moral bioenhancement. So public health ethics frequently deals with this question of what cost is legitimate to impose on individuals for the sake of the group. And that cost can either be sacrifice of well-being or liberty. So let's take a look at what public health ethics says about coercion in public health. So the World Health Organization says that restriction of human rights and involuntary detention can be used to control tuberculosis according to the following principles: that the restriction is carried out in accordance with the law, restriction is in the legitimate general interest, that the restriction is necessary, and there is no less intrusive and restrictive means to achieve the same objective, and the restriction is based on scientific evidence and not imposed with discrimination. So the World Health Organization embraces the idea of coercion using biological interventions to promote public health. James Childress, who was the author of the famous Principles of Biomedical Ethics with Tom Beecham, and colleagues have argued that there are 5 conditions which can justify the use of coercion in public health: effectiveness of the intervention, proportionality of the coercion, necessity, a principle of least infringement, like the WHO, that it involves the least infringement necessary to achieve the goal, and a public justification. The problem with both of these least restrictive alternatives is that very frequently greater restriction of liberty brings greater benefit. We saw this in the pandemic, that the more you locked people down or the more you restricted them, the more you curbed the spread of the virus. So one of the big issues in this debate is what constitutes a proportionate restriction of coercion. So for utilitarians, any level of coercion can be imposed on an individual, provided that the utility to others is greater. So John Harris has this famous paper on the survival lottery that says, according to utilitarianism, we could kill one healthy, innocent individual and take their organs to save 8 or 9 other lives, their heart, 2 lungs, a liver, kidneys, and so on. And that obviously is, most people would say, is disproportionate. So a much more relaxed version of consequentialism might be called easy rescue consequentialism, where the cost to the individual is small, but the benefit to another person is large. And with Tom Douglas and Alberto Giubilini, we've described what we call a collective duty of easy rescue, that a cost to an individual in terms of loss of well-being or liberty can be justified if the cost is small, but the benefit of everyone making that sacrifice to the collective is large. And this can be a basis for justifying mandatory vaccination. So mandatory vaccination. During the pandemic, I wrote this paper, which was the most cited paper in the Journal of Medical Ethics in May 2020, when it appeared to me obvious that vaccination would need to be made mandatory to be effective in COVID-19. And I discussed whether it should be mandatory or whether people should be paid to be vaccinated. And so I discussed these principles and argued that coercion can be justified according to John Stuart Mill's harm principle when there is a threat to others. So somebody waving a gun in a crowd can have their gun taken away from them because of the risk to others. This is Jessica Flanagan's example. And infectious disease is a case of an individual not waving a gun, but a lethal virus that can kill other people. And this is the basis for coercion, such as lockdown, quarantine, and mandatory vaccination. So in principle, coercion can be justified. And indeed, we have many coercive practices that promote public good or the public interest. Conscription in war, taxes are a form of coercion in the public interest. Mandatory seatbelt legislation. Seatbelts are, I'm not sure about Brazil, but in most Western countries, seatbelts are now compulsory. 50% of Americans opposed making them mandatory originally, and now 70% believe that such laws are justified. And they reduce the chance of death by 50%. Notably, seatbelts can kill people, so-called seatbelt syndrome, but the chances of being benefited vastly outweigh the chances of being killed by them, and they protect other occupants in the car. Even prior to COVID-19, a number of countries such as Australia, Italy, and the US had mandatory vaccination policy. And I've argued that this can be justified by a collective duty of easy rescue. I draw a distinction between mandatory vaccination, which is imposing disincentives to change behaviour, such as fines, versus compulsory vaccination, which is forcibly administering an intervention. Compulsory is clearly more coercive. So during the pandemic, I described this 4-stage algorithm for when vaccination can be mandatory. First of all, the problem being addressed has to be grave. There has to be a high level of confidence in the safety and effectiveness of the vaccines. There has to be a greater utility associated with coercion than any less coercive option. And the costs have to be proportionate. So, executing somebody because they were, or jailing somebody for 10 years if they didn't vaccinate themselves would be disproportionate. But a number of countries, such as Greece and Italy, imposed selective coercion for vaccination by fining elderly people who chose not to be vaccinated. So that's an example of selective mandatory vaccination, which I think was justified. I predicted in May 2020 that the safety and effectiveness of the vaccines might not be sufficient to justify mandatory vaccination, and incentivization may be preferable. And I think that was probably true, or a selective mandatory vaccination policy was justified, like Italy and Greece employed of coercing people who themselves are most at risk, because the vaccines turned out to be very poor at preventing transmission, but relatively better at providing individual protection. So should be employed on those who would put pressure on health services, and they were primarily the elderly. So there are a range of forms of coercion that you can employ that go from withholding benefits to financial penalties to various kinds of lockdowns and freedom. And one can draw a sliding scale of increasing coercion from attempts to persuade people, to withholding benefits, to financial penalties, to loss of freedom, to imprisonment, to forcible administration into the body. As I mentioned, what matters is proportionality, not adopting the least restrictive alternative, because often greater infringement of liberty achieves greater benefits. So we need coercion or disincentives or incentives because human beings or human populations are a mixture of self-interest and morality. Not everyone is moral. There are free riders, and vaccination, seatbelts, speeding, taxes are all in place because there is a necessity to constrain ordinary human disposition for the benefit of the collective. And how both incentives and disincentives work is that they align self-interest with morality. So say, you believe that the correct speed limit on a road that appropriately balances different values, including safety, is 100 kilometers an hour. Now, people who are moral will choose to stick to the speed limit and not threaten the lives of other people. But people who are self-interested will speed. So the presence of a fine means that now the cost of speeding to them may outweigh the benefits of speeding. So it now becomes in their self-interest to drive within the speed limit. Or likewise, if you were to provide financial incentives to people to stay within the speed limit, that would serve to increase the benefits of staying within the speed limit. So the cost-benefit ratio, again, falls on the side of their self-interest. So because of this dualism of practical reason between self-interest and morality, it's necessary in certain circumstances to align self-interest with morality, and that involves either using incentives or disincentives. Now, John Harrison and others have argued that making bioenhancement mandatory would make it no longer moral. And the same people have argued with providing financial incentives to do the right thing. And I think that's incorrect, because what they do is they allow self-interest to align with morality. So, for example, somebody who does the right thing because they believe that they will go to hell are doing it out of self-interest, not out of moral consideration. They're doing it because they want to avoid eternal torment. However, if you do the morally right thing because you believe it's the right thing to do, you're still acting for moral reasons. So to take, an example of coercion again, this fining people for breaking the speed limit. The presence of a fine does not mean that people who choose to drive within the speed limit are not acting morally. They are acting morally. It's just those who wouldn't stay within the speed limit now stay within the speed limit out of self-interest. So those who are self-interested free riders won't be acting morally, but those who have a moral disposition to act morally will still have the opportunity to act morally. So the presence of coercion does not necessarily mean that people can't choose to behave morally. So in the paper that Good Reasons to Vaccinate, I argued that paying people to be vaccinated could still allow people to be altruistic, because you could offer them to donate the money they were paid to the National Health System or to another charity. So you could still decide to do it out of goodwill and provide additional benefits from the money that you receive. Or if you weren't going to get vaccinated, but the money persuades you, then you are acting out of self-interest, but the outcome is the outcome we want. So moral bioenhancement can be viewed just like vaccination. We have a vaccine or a moral bioenhancement to protect others. We have a vaccination in some circumstances with low rates of coverage to protect ourselves. But a program of collective moral bioenhancement would also protect us from harm from other people. Just like in vaccination, people have different perceptions of their self-interest. They'll say it's not in their self-interest to be vaccinated, but nonetheless, we have to take an objective view and decide what is objectively good for the group. And just as we can promote, public health, we can promote reduction in impulsive violence, for example. And the cost or incentive changes self-interest, but it doesn't necessarily make the choice to behave morally or take the moral bioenhancement immoral if people can choose to do it themselves. And the reality is many people don't do the right thing. They don't stick to the speed limit. They don't pay their taxes. They do it out of self-interest because they'll be shamed, fined, or so on. And the same is true of moral bioenhancement. So this is how the algorithm would look for mandatory moral bioenhancement, employing the 4 stages. And I believe that if those are satisfied, then moral bioenhancement can be made mandatory. So this just summarizes some of those points. Again, the law exists to align self-interest and morality. We can still choose to do the right thing. We can choose to get vaccinated because it's right. And we could choose to be morally bioenhanced because we believe it's right. But if, say, for example, fines or restriction of liberty existed for those who didn't choose to be morally bioenhanced, then those individuals may choose it to avoid the cost and would be acting out of self-interest, but the group would still be protected. So we can stop people from infecting others by staying at home, and we can choose to stop being violent by becoming a monk, but nothing is lost if you take the bioenhancer, such as the vaccination or the moral bioenhancer, if it's safe. It's like a binding Ulysses contract. And people can not kill others either directly through violence or indirectly through infecting others, either because it's the right thing to do or because you will go to hell or jail or suffer some other punishment, and then it's done out of avoiding threat of punishment. Compulsory vaccination or moral bioenhancement, that is vaccinating somebody against their will, is taking away the moral choice. But if you, like in the vaccination case, allow people to choose under threat of coercion, they can still choose to behave morally if that's what they believe is the right thing to do. So placing a cost on not being vaccinated or morally bioenhanced does not mean people can't exercise their moral capacity. Depends on their reasons. And for those who need it to boost their self-interest, it then aligns self-interest and morality. So one objection is that this makes it impossible in some ongoing way to be immoral. And as Ingemar and I have argued, it depends on how moral bioenhancement works. If it, for example, makes people more empathetic, then it doesn't make it impossible. It simply makes people more likely to respond to reasons of the suffering of others. Just as women are more empathetic than men, nobody says that women are less free than men because they have greater empathy. But under some kinds of moral bioenhancement, it may make it impossible to behave immorally once you've taken it. But even in that case, once you've been vaccinated, you're less likely to infect others, and you can't take that away. So you can't take away your immunity. you could continuously isolate yourself or choose vaccination. So sometimes you make your choice and you're stuck with it, and you have made your bed and you have to lie in it. So if you chose to take moral bioenhancement that was irreversible, it's true that would be make future immoral behavior impossible, but so would the choice to be vaccinated make you no longer a threat to others. So in conclusion, I think mandatory vaccination or mandatory moral bioenhancement can, under certain circumstances, be justified. I mentioned 4 criteria: severity of the problem, and I've argued we're unfit for the future, that the intervention is safe and effective. Now, we currently don't have safe and effective moral bioenhancers, and part of the proposal of unfit for the future was that we should investigate developing these. We do have crude moral bioenhancers, such as anti-libidinal drugs for paedophilia or Ritalin for attention deficit disorder associated with violence. But we plainly need better moral bioenhancers. And thirdly, that the effectiveness of coercion is much greater than the alternatives. And lastly, that the form of coercion is proportionate to the incremental utility. Under certain circumstances, this does not remove the capacity to behave morally from moral motivations and reasons, just as the person who chooses to stay within the speed limit is still acting morally. But under conditions of lower confidence in long-term safety, other strategies such as incentivization may be preferable. So it may be that, just as in the vaccination case, it may be better to pay people to take moral bioenhancers, and the truly good could donate it back to various charities. So that's my argument for mandatory moral bioenhancement. I want to just quickly talk about this application. So in December, I published this paper called AutoGen, a personalized large language model for academic achievement. And the idea was that we could take large language models such as ChatGPT and train them on our own ideas, our own work. So what we did was fine-tune ChatGPT 3.5 using prompt templates such as this. Told ChatGPT, imagine that you're an academic writing a research paper. The paper should be interesting, comprehensive, clear, and concise. Based on the following title and abstract, write the section. So we initially trained it by feeding in 73 of my papers, 65 of Brian's, and 8 of Sebastian's. And we had also a combined model. And this was the training data that a research assistant inputted. And we compared the base model, that's the untrained version, with the personalized trained version, with developing different papers. And I created this idea of co-creation with ChatGPT, comparing the slave model of just using the results and a co-creation model. And you'll see that the personalized model is much richer and much closer to what, for example, in this case, I had in mind. And in the paper in AJOB, we took various examples of this and showed how the personalized model gave much better academic results. So we wanted to see how this would work, and I used this idea of mandatory moral bioenhancement, the vaccination analogy, as a test case. And so I'll show you what I gave it, but I estimate that I spent 15 minutes setting it up. Sebastian spent about 2 hours using ChatGPT, and then we probably spent a total of another 2 hours editing and reprogramming it into ChatGPT 4. So this is what I gave it. This is what I wrote up in 15 minutes. And you can see it's a rough summary of what I've just presented here, which I had already had this idea, and I just quickly jotted down these 4 sections. Now, it reproduced a very good paper, Here's the algorithm for mandatory bioenhancement that I gave it. And here's the paper that it produced. And it has, you can see different sections. I mean, when you read it, it's, very convincing. In fact, I've given this paper twice at bioethics conferences, just reading it without telling people that ChatGPT wrote it with that prompt. And around 50% in both or higher of those audiences thought it was publishable. And I think it is publishable. The only thing it didn't do was to flesh out one of the objections that I wanted it to address. And I had to write that myself, but that probably took me 15 or 20 minutes. And then we fed it into ChatGPT 4. So I think this is, I can send you the copy of the ChatGPT for the ChatGPT paper. I haven't submitted this to a journal, but I think this is a very promising way of accelerating our progress, because if you go back to here to the prompt, all of the ideas that are present here are basically the ideas in the paper, and it fills in some kind of historical quotes and some text around it. And it's would be very difficult, I think, for you to pick up from the paper that I hadn't written it. And again, this used my personalized model. So I think that we should be able to co-create with ChatGPT in this way. I think the challenge is to describe what contribution we've made and what contribution it's made. And I think that's possible in various ways, for example, by using blockchain. I think that, this is a good example of how, we can shorten what would be weeks of work with a human research assistant to just a few hours. And I think, and this is just the first go. This is the first. We haven't used higher orders of ChatGPT or Claude, and I think that offers a lot of opportunity for progress. So, one methodological point about the large language models, and then a substantive point about mandatory moral bioenhancement. I think it's important to recognize that in terms of both vaccination or spread of infection and moral enhancement, that we routinely employ many non-biological measures to, for example, prevent spread. So environmental control measures, social distancing is another example of a social method of preventing spread. And likewise for moral enhancement, education is a form of moral enhancement. So if we accept these environmental interventions to reduce the spread of disease or promote a certain kind of moral behavior, my argument is that we should use moral bioenhancement directly, not just in vaccination, but in terms of drugs or devices or gene editing or other interventions that will make for more moral behavior, provided that the cost to the individual is small and the collective benefit is large. It's in terms of behavior, there's an even stronger reason to use moral bioenhancers than vaccination, because the final common pathway for behavior is the human brain. What we do is determined by biological events in our brain. And the cause of those biological events is not something I believe that matters itself. So there are, there can be education or coercion or other social or psychological interventions that cause us to behave in certain ways. but ultimately that behavior is caused by firing of certain neurons. And if we can cause those neurons to fire directly through the use of direct biological interventions, then I don't believe there's any intrinsic moral difference between a social cause, a psychological cause, and a biological cause. And in particular, if we can preserve the element of free will that we want to preserve in the realm of morality, it seems to me that moral bioenhancement, mandatory moral bioenhancement, can be justified. So let me stop there and take some questions. But thank you very much for your attention.
Thank you very much, Professor Savulescu. Let's see who we have for questions. I guess Professor Nitamar raised a hand, then Alini. Then let's go for a few more. Maybe the other folks can have more questions also. Professor Nitamar.
Thank you very much, Julian. This was extremely interesting and instigating. Even though I understood your point quite well in your attempt to come up with a public justification for making mandatory moral bioenhancement acceptable in a liberal constitutional democracy, right? How do you deal with the question relating to let's say, flawed democracies or emergent democracies, not to mention authoritarian regimes, where the idea of having moral bioenhancement could be quite questionable, especially if we think of, an undesirable usage of this mandatory vaccination, at least in terms of your argument. What I'm trying to say is that in emergent democracies like ours, it's not always easy to figure out that we are dealing with the public good in a desirable ways, since our societies tend to be so polarized nowadays. So I'd like to see how would you deal with this question of making moral bioenhancement mandatory. Thank you very much. This was very good.
Yeah, that's a very good question, and yeah, I sort of feel the force of your objection. I think in one way it applies. Every powerful technology can be abused. So, for example, Russians are allegedly using various chatbots and forms of artificial intelligence to undermine democracy, and you can imagine other. I mean, the US, also uses, this sort of technology to, achieve its geopolitical strategic aims. So, and moral bioenhancement could be a very powerful technology. So I see the risk, but I think, just to go back to my last point, it's relatively easy to brainwash human beings who are like sheep, and tend to believe what they're told, and tend to follow ideologies, and that's social. And that force is very powerful. So I think at the moment, moral bioenhancers have quite a long way to get to be as strong as social re-education or social education. And there are many reasons to think that they would be more highly scrutinized than social means of thought control and mind control, because social means are very often difficult to identify and are very diffuse there. So people, to give you an example, in the area of doping in sport, there is, one way to dope in sport is to increase the number of red blood cells. That gives you more ability to carry oxygen. And there are 4 ways you can do this. One is you can go to altitude and your body will produce more red blood cells itself. Another one is to go inside a piece of technology called a hypoxic air tank, which reproduces low oxygen in the air, and your body produces more red blood cells. And both of those are legal. But both of them act by the kidney, the body picking up there is low oxygen, and the kidneys produce more erythropoietin. You can also increase red blood cells by giving injections of erythropoietin, which is a natural hormone, or you can donate blood and have it retransfused, your own blood, several months later. The last 2 are illegal. Now, why are they illegal? Because they involve a needle. They involve directly injecting somebody, whereas altitude is diffuse and we can't see it. So what goes in through a needle, through a biological intervention, comes under much greater scrutiny than what influences the natural or social environment. So people tend to think, if it's natural or if it's social, it's good, and if it's biological, it's bad. So I think there's also a pressure to scrutinize these more. Then there is a related question. Sorry for going on for so long, but it's such a difficult question. There is a further point that somebody might say, well, we don't know what a more moral society would be, and different countries will have different views. And so isn't this prone not to sort of flagrant abuse, but to cultural relativism or ethical relativism? And so, some country will promote greater religious adherence as being more moral. Another country will, promote libertarian sort of views of morality. And I think that is a good objection. And I think what we need for that is to agree on a kind of common morality for humanity that involves basic altruism, fairness, and that's a challenge that we face whether or not we have moral bioenhancement, because we have no way of dealing with poverty or climate change because we don't have an ethical theory about how to distribute benefits and burdens across people and across time. So yes, it's a huge challenge, but it's a huge challenge we face even if moral bioenhancement never occurs. So I think that we do need to agree. We need to reject ethical relativism and come to some sort of core of morality that we want to instill in future generations, that we want to guide our political and social decisions, but also our choice of moral bioenhancements. But thank you. It's a very difficult question to answer.
Aline, you have the floor.
Thank you. Thank you for your talk. It was very, well, it made me think a lot. And I was thinking about when you talked about moral choice, one of the points of consideration was self-interest, right? But did you consider the affectional part between people? Because during vaccine, one thing people said is that, okay, if you don't care about your life, think about the others, the ones you love. Or when normally we are upset with something, we say, well, I can take it, but don't mess with my family, or again, the ones I love. And so it seems like affection in this meaning of feeling or liking or loving someone is a very important part of incentive. Did you research that? You have interest in that? I would like to hear you say something about it.
Again, it's a very good point, and not one that I have researched, but except in one sense. But I think you're right. That is an important avenue to explore. And one of the ideas behind our book was that, if you think about the billions or trillions of dollars that are spent on medical treatments that extend life by, 6 months or a year. And basically nothing is spent thinking about these sorts of issues, that we really need to make this a much bigger priority. And, the issues that you describe are very appropriate for study. One of the in this moral bioenhancement debate, people like Paul Bloom and Peter Singer have argued that one of the features of our moral psychology is we do care about people who are near and dear to us. We care about our family and friends much more than we care about strangers. So they argue that this is an obstacle to alleviating poverty or climate change or other moral challenges. But you're correct. Maybe it's not. Maybe it's a lever that can cause us to change. So I was complaining about the speed limits getting lower and lower. And my colleague Jeff McMahon, who some of you will know, a philosopher in Oxford, said, I really like the lower speed limits because it makes it less likely that one of my children will be killed by an idiot on the roads. So he was appealing to, my care, my motivation for children. So I think if you can get people to extend their sentiment that drives them to be motivated for their family, to embrace, say, future generations or other people, then I think that could be a very effective, enhancer. The research that I've seen around biological interventions, however, says the opposite. So Carsten de Drew in the Netherlands has done research on giving people oxytocin. This is a neurohormone that the body produces during sex or massage or breastfeeding. And it makes people more concerned about the people close to them. So it's a sort of bonding hormone. So it makes you care even more about your children than you would. But it makes you care less about people who are not in your group. So you're much more concerned about your group, less concerned about other groups. So I think the idea that the fact of our partiality, it's sometimes called, is a very interesting challenge for the area of moral bioenhancement.
Professor, thank you for the answer, Professor Savulescu. Now, Professor Claudia Passos, please, you have the floor.
Can you hear me?
Yeah.
Yes. Yeah. Okay. Thank you, Julian. Very, very excellent talk. So I want to ask a little bit more about the last part of the talk, the personalized large language models, how this could enhance us, or at least morally enhance us. So it's clear for me that you might be able with those devices to make us smarter, to enhance our intelligence. But it's not clear that intelligence would correlate with morality. So I was wondering, what is your idea? How you could use the autogen to enhance us morally? It's not too obvious. You might become more. You can speed our cognitive capacities. You can enhance the cognitive capacities, but you didn't make a case that this would actually correlate with makes us morally better. So how do you think the autogen could make us could enhance us morally?
Yeah, I was just in that part just showing how it could generate a paper based on my previous talk. But actually, I do believe it can morally enhance us. So, I have some other slides, but I'll just quickly describe the idea. So you can personalize a model on your own writings, your own answers to questions, your own stories, your own social media. in a way that creates a version of ChatGPT with your values, but it still has access to all human knowledge and experience, at least statistically. So what I did was I used my personalized model to ask it about a difficult ethical issue I had in about a sort of 15 or 18 months ago, where my wife and I was saying before, my wife was pregnant and we had an abnormality diagnosed in the baby's brain. And eventually it turned out that we were 24 weeks pregnant. So the baby was capable of being born alive, and there was a 10% chance of severe brain abnormalities, blindness, intellectual disability, epilepsy, pituitary abnormalities, etc. So in this case, I asked her, what would I do? Because I wanted to see if it could predict what I did. But it gave a very nice analysis of the ethical issues. It outlined the factors. It depends on the severity of the brain abnormality. Not all abnormalities, make a life not worth living. In fact, they can enhance it. It depends on the values of the parents, their choices. It depends on, it gave a whole bunch of factors. So it was actually a very good, if it was a student, I would have given it a good mark for how it analysed the ethics of the decision. But then I asked it, well, what would I choose? Because I wanted to see if it would predict what I did choose. And it said, yeah, you'll continue the pregnancy, which I found really scary because I've written a lot on termination of pregnancy and selecting the best child. So that wasn't straightforwardly asking what I should do, but it did give a very nice analysis of the ethics of the situation, much better than anyone I spoke to. Now, that was a version of me. You can also create a personalized versions of your favorite moral sage or guru. So you could take a model and train it on Peter Singer's writing, or Jesus's writings in the Bible, or Buddha, or Xi Jinping, or anyone. And you would be able to have a conversation with that individual and ask them, what do they think you should do? So actually, you now have the ability to engage, not just with your family and friends and maybe look on the internet, but you have the ability to engage with a better version of yourself, or not a different version of yourself. And then also whoever you want to talk to about some issue and have a moral dialogue about. Now, what I've argued is, as long as we continue to take the first personal stance, that is, we evaluate what these moral gurus say and we come to our own decision, we preserve our humanity. Of course, the danger is we'll just accept what, the Pope, the sort of the large language model from the Pope says, and we'll say, well, that's the authority. But we should never just accept authority. Even if we have to obey the law, we should still always ask, is this what I should do? And I think there is a huge opportunity for moral progress and dialogue by using these personalized models of other individuals who we can't normally access. So the famous philosopher Daniel Dennett, philosopher of mind, they took his work and trained a large language, a ChatGPT, and created DigiDan. And then they tested DigiDan with 10 questions and got Daniel Dennett to answer the same 10 questions. And experts on Dennett scholarship couldn't tell the difference, couldn't tell. In fact, Dennett himself apparently said DigiDan was better than him because it didn't forget what he'd written 30 years before. So I think this is an enormous opportunity, not for sort of direct bioenhancement, but for sort of enhancement by artificial intelligence. Of course, it can be used to dominate and subjugate people. It can be used to cause them to become slaves, and it depends on how we use it.
Can I just ask one follow-up question?
Yes, you can, Professor.
Yeah, I don't know if you have time. Yeah, so it's a very good example how we can maybe enhance our own moral capacities. It seems that the system would help us to make better decisions, but it still depends on us to come with the good intentions. I could also enhance maybe all my bad intentions. Imagine, I don't know, you thought maybe I would have a version of the Pope, but I could have a version of a ChatGPT Hitler that expands all his, the system help make better choices given the intentions you start. So if you start with a bad intention, maybe you would expand your bad intentions. I don't know.
Yeah, I mean, absolutely. So, and as I said in the answer to the first question, a knife can be used to sort of cut food or kill someone. Every technology that, can be used for good can be used for bad. And it really depends on the way in which we make it available. And so, what will happen is it'll be made available to generate profit for large multinational corporations with no attention to people's well-being, their freedom, progress, just profit. And that will be bad, just like social media has. These companies like Google, Meta, and so on have a huge amount of information about us that they could use to actually create good intentions if they wanted to. But what they create intentions to buy. And so, there is enormous scope to actually even change people's intentions, but it won't. I doubt that will happen. I think what will happen is that this will become just another product that we consume. But that's capitalism. That's the world we live in.
Thank you, Professor, for the answer. And I'll have the last question, which is a double question from Murilo Vilaça from PUCRS, Brazil. So he asks you, Professor, first, in your texts, you and your colleagues have focused on moral bioenhancements through biomedical artifacts, especially pharmacological ones, if I'm not mistaken. Many objections have been raised to the safety and effectiveness of this type of intervention. Do you think it would be interesting to shift the focus to other technologies such as virtual or augmented reality or BCIs? Second, do you recognize some limits to the analogy between vaccination and human bioenhancement, both in terms of the functioning and complexity of interventions on human biology and the objective of each of them? And finally, the justification we could require for each one.
Yeah, well, I agree with both those points. So, we argued for moral bioenhancement because nobody is really seriously considering that. But I think that there are 4 ways in which you can achieve any valuable outcome, whether it's morality, happiness, security. You can change the natural environment, you can change the social environment, you can change human psychology, or you can change their biology. Now, our argument is we should look at all of these and work out what the best combination is, not just one, not just political. People say, oh, the solution to these problems is political. Politics has failed. Democracy has failed. So, it's time to look at all the possibilities of virtual reality, BCI, everything. We should look at everything and evaluate it and evaluate combinations. So I don't mean to suggest that this is the best way forward or the only way forward, but it's a way forward that we shouldn't rule out. And most people rule it out because they say that, it would not actually, make us more moral. And I agree completely with the second point that, there clearly are disanalogies between getting your body to produce more antibodies and getting your mind to function in a different way with a lot of other implications. So it's a very crude analogy, but in any talk, you can only just make a cartoon sketch of an issue. And this is a cartoon sketch. But, if I were to write a book on this, we could go through the various differences and disanalogies. But I think it's enough to start a debate about, what should the limits of mandatory moral bioenhancement be? So just to sort of give another example, way before the pandemic, I wrote a paper called mandatory vaccination, the seatbelt analogy. And I gave this analogy between vaccination and seatbelts. And then people can, say, well, there are differences between seatbelts and vaccination, and so the analogy isn't sort of correct. Well, yeah, there are differences, but there are also similarities, and so I think any analogy is going to be imperfect. And I agree, there's a lot more to the mandatory bioenhancement debate than I've been able to sort of cover today. Look, I don't know whether it's right or wrong, but I do think we should think more about it.
Thank you, Professor Savulescu, for all the answers to all the questions. And now we go for the next lecture with Professor Kenneth Goodman. Bye, Professor Savulescu, probably
Thanks
too late.
Yeah, I hope to see you again. I hope in person in the future. Bye.
For sure. Bye.
Bye.
So the next lecture is from Professor Kenneth Goodman. He's founder and director of the University of Miami Miller School of Medicine Institute for Bioethics and Health Policy, and director of the university's ethics program, professor of medicine at the University of Miami with appointments in the Department of Philosophy, School of Nursing and Health Studies, and Department of Public Health Sciences. The title of the lecture is An AI Skein, the World and Representations of the World. So, Professor Kenneth Goodman, the floor is yours.
Thank you so very much, and how good to see all of you. Let me have a what we call an emo moment. Nita, thank you so very much for including us. This, for those of you who don't know, continues a relationship between the Pontifical University and the University of Miami that goes back many years, and to be able to continue this collaboration means a lot, and I'm grateful. Thank you. We have a lot to talk about. I see Julian has left. I wanted to suggest to him, when I saw the title of his talk, I inferred that it was a reductio argument to prove exactly the opposite of what he was seeming to argue for. Mandatory, and I actually have not given his more remarks at the very end. I think I'm probably right. But nevertheless, what we do when we do philosophy and related fields is stimulate, assess, weigh, and balance ideas. And I can't begin to tell you, especially given his remarks about the importance of democracy, how much that matters. Yes, we're all moral realists, but it's those who disagree with us that I don't want doing any biological mandatory enhancement. And right now in some of our countries, there's a real risk of that happening. Can you imagine mandatory moral enhancement in the Third Reich? We don't. But in any case, thank you again very much for being here. I have a few slides, and I will share them, but I want to de-emphasize them for a number of different reasons. Let me just share my screen here and do that, and then do this. Where's that button? Hang on, I'm covering myself up here. Where's my button? News. Oh, it's at the bottom. You see, it's so much for technology, right? Okay, I want to. The word skein is a challenging word. It's sometimes used to describe balls of yarn that you would knit with, but sometimes, or the shape of it, the circle, but sometimes it implies a bit of a jumble that covers what you're trying to see with a membrane or a layer of some sort of impediment. I think that's an interesting and perhaps even provocative view of things. But I want you to think about that. In some sense, there's a talk about ethics, but it's also one that I will hope you will forgive me for trying to take an epistemologic turn, how we understand the world, how we use representations of the world, how they may or may not increase our understanding of the world. Okay. By way of introduction, I want to remind everybody about the science of meta-analysis in biostatistics. If you remember, there used to be some time ago, back before everybody got excited about artificial intelligence, there used to be other things in medical journals. And one of them that was a hot topic for a very long time, and still is in some quarters, is the technique of meta-analysis, developed early in the last century by the biostatistician Carl Pearson. It basically allows you to take several data sets. I'm going to demonstrate the Cochrane collaboration's way of representing these. Here's a line down the middle. Here's one study that has a large sample size, but is negative. Here's one with a smaller sample size that's positive. And now imagine in public health or oncology or internal medicine, hundreds of studies. And some of them point in one direction, some of them point in the other. This led to great debates about what's the gold standard for doing biomedical research. And people say, no, it remains the randomized double-blind control study, which are very, very expensive, very, very complicated to undertake, and in fact, put people at risk. So wouldn't it be nice if we'd done enough of those studies and they show results that are inconclusive, different sizes, different results, but we can measure the effect sizes and rank them, and then give a kind of a summation of all the other research that has taken place on a particular question. And that would then show, ideally, a clear answer. Is one side stronger than the other after we've combined the results of many studies? It is still used a lot in many different sciences. It is still interesting. I think it can be useful in a number of circumstances. However, one of the problems about meta-analysis is that after a point, the source of your data or your information for your research is no longer the world. It's no longer measurements of something that occurred in the world. Your data and your information are now representations of the world, namely other people's studies. Okay, now that's the whole point of it, right? But what I became uncomfortable, and I want to, if I succeed today, I'll make you uncomfortable too. How long can a civilization that is constantly doing science, how long would a meta-analysis be allowed to guide a physician, for example, in her practice? Imagine the last double-blind trial for a particular condition or malady was 10 years ago, or 20 years ago, or 30 years ago. Would you use your meta-analysis tomorrow? And the answer is, well, it's still the best we've got because there's never been a really large study that answered the question. It's the best we have. And then I say, all right, well, maybe it'd be good enough in the absence of anything better to guide someone in clinical practice. But I confess to you a certain epistemologic uneasiness that we are actually making decisions in the world based not on prior data or evidence about the world to support whatever induction is we have, or perhaps even deduction, but something else, namely reports about the world. I'm not sure that matters very much, how it will matter, what the consequences could be, and I cannot at all imagine what it would be like to test this. We'd have to have one civilization do it one way and another do it another. By the way, those kinds of thought experiments are wonderful. Imagine we could do any science we wanted, and we would basically turn entire civilizations, maybe on other planets, into control groups. And then we watch civilizations evolve over a few centuries and see who gets it right. So that Julian would find a population that's happy to be compelled to be morally enhanced. But you see the problem. It's a detethering or a decoupling of the world from our science. Our science is now, here's our science, here's the world, and in the middle, in my head, are representations of the world. Okay. Now, in some sense, there's a challenge there for all science, namely it's when we make a measurement of the world, we write something down, we make an image, we do a test or an observation or an experiment, and we write down or record what it is we found. And that, of course, is a representation of the world, right? But it's a more direct representation of the phenomenon that we are trying to study. Okay. Now I want you to consider, to begin with, we'll talk about other fields or domains or sciences later. But I want you to imagine in medicine, the use of artificial intelligence in medicine, about which we have all read and thought a lot. We are in the middle of what, Anita, you know what really makes me unhappy is every time I look at the pictures in the room, it looks like I'm the oldest one in the room. You need to invite older people to this. In my life, hereby signaling my many advanced years, I have not seen anything so completely capture, transform, intrigue, and engage professionals in both the health sciences and in philosophy as artificial intelligence. You will not open a journal from any country in any field without seeing an article about artificial intelligence. We didn't see that, at least this quickly, with genetics, and it died off pretty quickly. We didn't see it with evidence-based practice, and when we did, it dropped off pretty steadily. We don't see this with end-of-life care. We don't see it with genetic enhancement. We don't see it with any new technology. And the new technology could be end-of-life technology. It could be artificial hearts or ECMO, extracorporeal membrane oxygenation. Whatever it is, all of the sciences, all of the issues, all of the conflicts that have fed bioethics, for instance, for generations, are paling in the face of artificial intelligence. And I think that's interesting. This is really embarrassing, Nita. I need to pause my microphone and my camera so I can sneeze. Just one moment. I apologize. This is very embarrassing. Where's my, here it is. You know, all the things that happen to us in the world, I'm trying not to sneeze in the middle of a very important prison. And it was one of those sneezes that was right there. And I'm doing this, and I'm looking up at the light, and nothing is working. And there are all these people in the room. I apologize. I may need to do that again in a while. Okay, here's my challenge to our communities, based on the following assumption, that if we're going to be using, for example, a large language model to support clinicians in a diagnosis or a prognosis, I find those to be the really most interesting, engaging, challenging, controversial possible uses of intelligent machines in healthcare, namely computer programs that will actually help you render a diagnosis. We've had them around, by the way, 40 years. We just never paid attention to them until last week. But imagine in the electronic health record, there's a button. You have your patient's records are there. You're a nurse, you're a physician, whatever it is you are. And either you do it for sport, or you do it because you are genuinely unsure of your patient's diagnosis. And so you push the diagnosis button, and it gives you a range of diagnoses. It gives in order, and it will give you all the differential diagnoses as well. And they're ranked, and you can even put percentages of confidence in them. Quite interesting. There are great questions that surround this, as we've discussed. They include who should be using this, what's an appropriate context of its use, and so forth. Well, let's imagine we've addressed that, and we believe that it's either permissible or, depending on how good the robot is, might be obligatory to use this new tool, which, by the way, has been shown in independent research to be accurate more reliably and more frequently than human experts. So you push the button, you get a diagnosis. Cool. Or let's talk about prognosis. I find these to be even more exciting ethically. The prognosis might be used by our colleagues in critical care medicine to produce an estimate of whether or not you think your patient is going to die. And a really good program with a very large training set will give you a probability of the patient dying. Or if you want to put it in the other direction, the probability of the patient surviving to discharge from the hospital. It's trained on thousands and thousands of other patients who had the same physiologic profile as the one you have this afternoon. It has been tested and compared to humans. It is far more reliable and far more accurate than humans. And now we find a way to introduce this into the clinical decision process, including the point at which someone needs to go talk to the patient or the family members and say, we have determined that no matter what we do, this patient is going to die. Therefore, we should not go through a therapeutic frenzy, which will have the adverse consequence of ensuring that the patient dies badly, violently, with lots of interventions which we knew in advance would not work. And so now you're using this machine for what we call goals of care conversations with your patient. Seems pretty compelling. It's one of the oldest questions in medicine. So Dr. Nita, if you're my critical care doctor, what I really want to know, or what my brother wants to know, or my partner wants to know, or my daughter wants to know is, what are his chances? Is he going to live or die? This question's as old as it goes back to the ancients, where, by the way, Hippocrates, parentheses, we actually do not know whether there was any person called Hippocrates. Historians are not sure he existed. There were a number of physicians in ancient Greece. If there was a Hippocrates, there were a number of them around at the time. It could have been some of his students. And what we call the Hippocratic corpus, we're not even sure who wrote it. Nevertheless, there's a wonderful quote where Hippocrates says something to the effect of, well, if you examine your patient and you know what he did for a living and you know where he came from, you'll be able to make accurate predictions in a large number of cases. Arguably, a kind of foundation of evidence-based practice, right? Gather more data, because the world, unless we want to be skeptics about it, tends to be pretty regular. The process, the practice, the science of medicine is made possible precisely because, on balance, if a patient with a bacterial infection is given an antibiotic, the antibiotic will cure the infection, right? It's not that one day we wake up and we find the world is so, how should we say, so silly or so beguiled by evil geniuses that one day antibiotics don't work at all. We were just wrong about antibiotics. Right? We might be wrong about them one day in the future, but that's because we overprescribed them. We prescribed them inappropriately, and we created a bunch of drug-resistant strains. But it wasn't because the science undergirding it, or because the human immune system, actually, we misunderstood it completely, and certain infections are not cured by antibiotics. In other words, the comfort, if you will, for an epistemologic universalist or realist is, there is, we still hope, a uniquely true description of the world, and that is knowable. Okay. But now we've got a button, and the button basically says, no matter what you do, no matter what doctors you have, no matter what science you use, this patient is going to die. It would then be arguably irrational not, at the very least, to incorporate that into your decision making. I think most reasonable people would say if the best evidence, especially if there's a human in the loop who concurs with this, it becomes irrational to not accept that advice. In fact, an institution might plausibly say, we're not going to provide aggressive treatment whether you agree or not. There are many things in hospitals we don't do simply because we're asked. Parenthetically, making the very important distinction between requests and refusals. Everybody agrees in the world of bioethics, at least, that if I'm your patient and I'm adequately informed, have mental capacity, and to making a voluntary decision, namely, I meet the criteria for valid consent. That's on the quiz: adequate information, voluntariness, and capacity. True in both clinical care and biomedical research. And if I meet those criteria and I say to you, thank you very much, Dr. Nita, I don't want your chemotherapy drug, I don't want your surgery, I don't want your resuscitation, then I think most of us would agree that you are duty bound to honor that refusal. We describe it as a protection against unwanted touching. Okay. On the other hand, there are many requests that patients might make, and those requests need to be evaluated by a competent clinician before it's decided whether or not the request should be honored. So if I say to you, I want a new kidney, and you say, but Ken, your kidney's working just fine. And I say, I know, but I would just like a new kidney. I'm willing to pay for it. Or to paraphrase a colleague of mine, he says, I've got a mole on this hand. I want you to remove it and put it on this hand. I would just rather have the mark on my right hand. Or I've got a big weekend coming up, and I need you to, as my medic, to write a prescription. I'll be needing an antibiotic, some anti-anxiety medication, definitely some opiates and some Viagra, because it's going to be one of those weekends. Now, you could plausibly say to me, Ken, yes, I'm authorized by my country's licensure process to prescribe all of those drugs, but there is no indication for any of them, and your request is not binding. It does not impose on me a duty to accede to, or to agree with, or to comply with your request, because in my clinical judgment, none of those drugs is appropriate for you. Right? A good medic at that point will not write those prescriptions. Okay. Now I say, for the sake of a reductio argument, I know I don't look it, but I'm 120 years old. I have metastatic pancreatic cancer. I'm in multi-system organ failure, and my finger really hurts. So I am really, really old. I am actively dying. And I say to you, I want you to get a surgeon quickly, and I want you to do an exploratory laparotomy. I want you to cut open my chest and have a look around and see if you can fix something. You will not find a surgeon to do that. Surgeons all the time. Is Dr. Latevka here? My colleague from Miami, he's in the room somewhere. I hope he will, as a recovering surgeon, will agree that if you're a surgeon, you need to use your clinical judgment, decide whether or not you can even attempt the case. And you do not want to take on a case where you believe that the risks are far higher, even maybe slightly higher, than potential benefits. Okay. In other words, refusals are fundamental. Requests must be assessed in clinical judgment. Okay. Therefore, that system, that prognostic scoring system, that system that says whether I'm going to live or die or not, it would be irrational not to incorporate that in decision-making around my case. Okay. in the case of the diagnosis, in the case of the prognosis. You document in the electronic health record what clinical facts were salient and the decision that was made to either do this or do that. And now I want you to allow a few months or a few years to pass, where because these AI programs are so good and so accurate and so reliable, that the notes in the chart are variably superseded by other notes, documented as you wish. Maybe the notes can be written by ChatGPT, but let's assume they're not. Let's assume they're written by humans. But they are documenting decisions that were shaped by an AI program. Poco a poco it might be, but sooner or later, the entire electronic health record becomes, and it could be months, it could be years, all evolves, because it would be odd not to capture the fact that all of these clinical decisions have been informed at least a little by an artificial entity, a large language model of one sort or another. Or in the future, there might be even better, and we can't even imagine their software yet. I assure you, in the early days of artificial intelligence, no one conceived of what a large language model might be. So not only do we get to look forward to these evolving and getting better, we can't even imagine what the next generation of software will look like, and the fact that it's likely to be processed on a quantum computer. Okay. So now you're with me in my thought experiment. The electronic health record slowly becomes replaced or updated with notes for all patients across the entire system with documentation based on a robotic decision support system. What that means is that moving forward, all of the decisions that all the diagnostic queries we make and all of the prognostic queries we make are being answered in part based on the electronic health record. And so the challenge that I have, and what I find to be, I say, both ethically and epistemologically quite interesting is, does that matter in any interesting or important sense? Because once the data sets that we're using are themselves shaped by this new technology, then the new technology will be in some sense running on its own decisions. That's what humans have been doing for a long time. We discover when we're mistaken. It might be the AI programs that are doing this might discover different patterns that they would later regard as a mistake. But fundamentally, the entire biomedical corpus, all of it, is replaced by accounts of decisions that were made based not on our measurements of the world, my pulse, your physical exam, and so forth, but by representations of that as processed by a computer. Now, either A, there are several possible responses to this. One of them doesn't matter, it's not that big a deal. Another is, that might matter a great deal in terms of ethics as regards, for example, one of the reasons why standards of care sometimes change is because sometimes people will do things for which there's not compelling evidence, but for which a learned clinician says, based on what I know about this and that, not to mention the patient population, my familiarity with the literature, and my understanding of how the pathophysiology of my patients compares to those in the literature, and I'm not going to follow the practice guideline. I'm going to try something else. We would not regard that as irrational. In fact, given the debates over evidence-based practice, we could regard that as actually something that is obligatory. Namely, if you have reason to believe that the cohort that produced the data and evidence on which you are basing your clinician does not represent your patient, then you could argue that you probably ought to use your clinical judgment and consider something else, which, when it works, changes the standard of care just a little. Would a system in which the machine is constantly evaluating notes loses that opportunity because it always will tend to agree with itself, given the fact that it was always producing the most likely best answer? In which case, there is a possibility, a risk, if you prefer, that all of our corpuses, the bodies of knowledge that we have, on which we base life and death decisions, will be based not on the best available evidence that we have today, but rather on the basis of previous decisions that were based on whatever the previous best available evidence was. In other words, there's a decoupling there between our clinical decision-making and the body of evidence that we have, and which is constantly changing. In that brave new world, I can imagine wonderful debates where we say, well, hang on, what percentage of the replacement of the EHR is a concern for this? Or do we need to go in by hand and somehow put some old human mistakes in to make sure that the machine is actually being fully tuned or fully trained? But I think that those will be fun debates. The question that I have is, among others, and I'll ask you for other questions that you might have, is, does the rapidity or frequency of the database update matter? In other words, and let me give you an example now from public health, follow up on Julian's provocative talk. We talk about the use of artificial intelligence agents, systems, tools, very often in clinical practice, because there, as I told you, you got some very, very interesting and equally provocative challenges. Ought I rely on this to make a diagnosis? Ought I rely on this to make a prognosis or to shape a treatment plan as you have it? We're now looking at the ways in which artificial intelligence can help inform the research enterprise by coming up with study ideas, by proposing different ways of study design, by helping to analyze and interpret the results, and so forth. There is far less contemplation about the role of intelligent agents in epidemiology and public health. And so I wanted to challenge you by asking you to imagine your local health official using so let's make it a large language model, maybe a generative AI system, to make public health decisions, to help guide management of an evolving infectious disease outbreak. In that case, all we have are the raw data. Would that be more or less reliable than something that's based on representations of the data, or representations of previous uses of the data, which is slightly more accurate? And if, depending on the nature of the data set, because we've all learned over the last year and a half that the training of the algorithm on the data set is a really crucial part of the process, and one where there lie many difficult ethical issues. If your data set is not representative of the community, the algorithm that you develop is likely to be biased. Is your process going to be transparent? Who is accountable for the results? And so on and so forth. All the issues that everybody now knows that we enumerate when it comes to the ethical issues that arise in the use of intelligent machines in clinical practice. We have none of that in epidemiology and public health. So does frequency or rapidity of the update matter with real world measurements? Namely, here is the frequency with which we are seeing cases of COVID or Zika or Ebola. Can we use something like this? Especially, we were, I don't know if you all remember Zika. I remember I was in Brazil during some of the early days of Zika. We were also having some cases in Miami. And I've never, look, I grew up in Miami. We know mosquitoes, but I found myself walking around like this, looking for mosquitoes, like I was the security guard for the president. It's like this. I think I caused lung damage by inhaling too much mosquito repellent. I don't know. In any case, we know that vector-borne diseases and the vectors, in many cases, mosquitoes, are evolving and their migration patterns are changing in the course of climate change. It's one of the reasons we're getting Zika and dengue in Miami, right? Wouldn't it be interesting to have the ability to survey two vast literatures and be able to make predictions about emerging and evolving diseases? Imagine you did that for a few years and you made predictions that you never acted on, but you found a reliable predictor of future outbreaks, for example, of COVID. I forget if I told you this, Nita. During COVID, we had a grant here, University of Miami, to analyze wastewater. And I was on a team. I was the boffin who was there to help with ethics. But the team was going to, they did it on campus on the University of Miami's Coral Gables campus. And I'm very proud of this. I'm a philosopher, but I put on one of those suits, the cover and all this, the white suits and with a mask and everything. And I was with the scientists who were taking buckets of sewage out of the sewer. My first thought was, please do not tell me this is a metaphor for philosophy. But then I thought, this is real science, and I'm glad to be doing some of it. Of course, the sewage samples were sent to the laboratory. In the laboratory, they analyzed the components of the wastewater, including the presence and the volume of COVID cells of bacteria. And what we discovered was a very nice correlation between analyzing the sewage and a little bit later seeing an increase in hospital admissions. So it was thought to be a very useful planning tool and early warning system. When do you need to put in place extra controls on a university campus? When do you need to warn the hospital it is likely to have a surge in the future? Real data pulled right out of the sewers. Okay. But doing it on a regular basis. And in fact, some of them, they developed automatic machines for automatic sampling. So that you don't need to put on the suit and go there and put it in the bucket and pull it out, right? The water is diverted every once in a while, is automatically analyzed, and then the Wi-Fi network is sent digitally to, how cool is that? Okay. Then imagine the oncologist saying, well, what else are you finding? We got some viruses, lots of bacteria, and we show this fluctuating over time. The oncologists are thinking, boy, if we knew that, is there a correlation between what you're detecting in viruses and future cancer cases, or anything else for that matter? So there's great excitement about the use of this in public health as a potential early warning system. I should mention to you, as perhaps some of you know, although none of you is old enough, that in the early days of polio, not the early days of polio, but in the 1940s, the first reports of polio in the community were reports of polio in wastewater. That's how we measure it. right? So you can see there's potentially great utility here. Okay. Does public health differ in that way from clinical practice? Or let's look at the rest of the world. I want you to imagine AI helping us with decisions in education, law enforcement, business and finance, science. Maybe it's cosmology, in which case, while it might be beautiful, we might make a false interpretation of the amount of dark energy in the world and the universe, right? Government, sport, arts, and so on and so forth. Once again, I want you to imagine a world in which the store of knowledge, the corpus, if you will, of what we believe to be facts, or even if you prefer, justified true beliefs. And all of them eventually are replaced by facts that were identified or discovered by an artificial intelligence program. So when it comes to education policy and how children learn, how adults learn, everything now that we rely on is a body of research in which artificial intelligence was used to guide decisions. Imagine it in law enforcement. As soon as I say that, it instantly becomes chilling, because at that point, you'll have humans making inferences about other humans' behavior, criminal behavior, or its likelihood in the future based on reports that were compiled by an intelligent machine. Imagine it in business and finance. I don't know anything about business or finance, and I certainly don't know anything about the stock market, other than what I understand about stock markets is they're very similar to casinos. But that aside, it would seem there you're going to have rapid updating of the database with stuff that is directly from the world. In other words, I have this lens here. I like looking through this sometimes. I'm manufacturing this. This is actually a special lens that lets me look into another dimension, another space-time dimension. I like the 8th dimension, like Buckaroo Banzai. And in any case, the point is that you imagine in the stock market, you're getting all of that information, and I want to make a lot of money off of these. And so my company starts selling them. As it's selling these, the price of the stock in real time, in the real world, is being tracked in those databases. Closer or more direct reports of the world than a subsequent analysis. Although I reckon when people look at trends over time in the economy and the stock market, that's a separate database, a separate corpus in the beautiful science of economics, and therefore something that might actually cause us to begin making decisions not based on what we know about the world, but based on decisions that we've made, which were in turn based on intelligent machines' understanding of data about the world. Government, sport, arts, and so forth. Okay. Now, that is my concern. As you can see, it's ethically interesting because it means that humans are becoming increasingly decoupled from an ancient profession in which intimate human action has been correctly valued for thousands of years. That's a challenge. That's a problem. Epistemologically, for those of us who are not relativists and believe we can, in fact, make progress through the growth of knowledge in the direction, perhaps asymptotically, to a uniquely true description of the world. If we find that's a problem for universalism or realism, we can adjust later. For now, I want to make the philosophical point that we're presuming a realistic account of the world. But that account of the world is now based as best we can understand it, not on direct measurements of the world, but on reports about decisions that were made by people in the world. Does that mean we need to have a kind of system of asterisks or footnotes when we assert something to be true, a kind of AI disclosure, the way people insist on elsewhere? Did you use an AI program to derive this result? Comes up in the hospital all the time. Apparently patients will want to know that. They'll want to know, did you use an intelligent machine to come up with my diagnosis or the prognosis? Some patients are already demanding it. Some patients are highly skeptical. How do we manage transparency around that? Do we need to come up with a way of tagging or annotating the corpus that we use to tune our algorithms to show that the corpus itself was shaped by algorithms, not by data about the world? And that is what I wanted to share with you this morning. I see the time is flying, and I think perhaps if I might do that, Nita, say it's I've already said more than I know, and maybe we can have some questions around it. Once again, my interest here is that this is both ethically and epistemologically interesting, and that it raises questions that I think are underaddressed, particularly when it comes to things we care about in the health professions, public health science, and epidemiology. So comments or questions, please. Yes, Nita.
Thank you, Professor Goodman. Professor Nitamar, you have the floor.
Thank you so much, Ken, for this beautiful presentation. We are always learning so much from you. And one point that you had also raised in your 3 very interesting talks you gave at PUC in Porto Alegre, and also Professor Sergio Litelka was dealing with some of these questions during this very event this week, which relates to the whole thing of medical doctor machine interactions. And I understand that you've always been for the usage of AI and AI-based technologies to be used by medical doctors and researchers in health science programs. Oops, I'm afraid that we lost Ken.
No, Ken's sneezing again.
Oh, you there? All right. So my question is, what do you make of this whole thing? Because some people think that let's say, the bottom line is that we should never allow for machines or these new technologies, including AI systems, to be completely unsupervised. And I don't know what kinds of real-life situations you're facing now at the 3-4 hospitals you are working at the University of Miami. So how do you deal with your medical doctor and colleagues when it comes to this whole thing of how far we're going to be, allowing for AI technologies to go without human supervision? Thank you.
Well, thank you for that. By the way, I recently heard there's a new job description in the world. It's called AI Ethics Officer. Apparently people are recommending that if an institution is going to be using the software, there should be a special institutional official who is able to provide the kind of governance and oversight that might be appropriate. Not case by case, but perhaps in terms of developing institutional policies about appropriate uses and appropriate users of the technology. I'm an advocate for more research. I think it's very important that we understand these systems better. I don't believe that most clinicians are adequately educated to use them yet. I don't believe we have adequate review structures in place to approve the software that's used in the hospitals. One of my concerns, and thank you for helping me make the point, is it was important when I said this will be in the electronic health record. The electronic health record is provided by a corporation almost everywhere. Those corporations have an interest in making sure that people use their systems in a certain way, and they will update it according to a certain schedule. But the software that you get I don't know how often that's going to be updated. There's no transparency around that. And so one of the things that I would wonder about is now, if you look in the chart, how frequently, while the notes are constantly available, does the algorithm have access to all the notes? Or, which is usually done for security purposes, is the algorithm operating on a copy of the health record? And if so, when was that copy made? In other words, it's a question about how up to date it is. So I think I'm not so much a supporter of the use of these as much as a supporter of more research to judge how well they can improve the care of patients, which is why I find the example I gave earlier to be such a challenging one. Namely, if you have good reason to believe that a machine is consistently more accurate than yourself, look, that's why we use glasses. That's why we have stethoscopes. That's why we have all the tools that we have in the world, is that we know that many machines help us do our jobs better than we would have otherwise. But unlike the machines that help us see better or hear better or touch or palpate better, these are machines that are ostensibly helping us to think better. And that is novel. And so to your excellent question, what I want to say is, I think I want to tap the brakes. These, and by the way, therefore, the program that will be available in your electronic health record is the one your vendor gives you. If there is anything that happens that's like what happened with the pharmaceutical industry, where we have competing companies that are trying to advance the prescribing of their drugs by direct marketing to physicians, here we have corporations that are advancing their economic interests by direct marketing to hospitals, which will not be able to compare the performance of one large language model to another easily on the same database, because they're proprietary systems. In other words, the vendors or the companies that manufacture the electronic health records are in fact going to stipulate which software you use. And they become therefore responsible perhaps for all of these questions, which is a problem because never before in the history of medicine would a physician or nurse say, out of my hands, I'm just using this tool. We have traditionally required that humans be accountable for and take responsibility for their use of the tools. And the counter argument, the counter pressure, of course, is are there any lawyers in the room? I wonder. Any lawyers? When I talk to lawyers about this, they find it very, very interesting. Luana, you'll let me know if this is interesting to you, please. So suppose Dr. Nitamar is my physician, and he uses a distinguished physician, an expert in his field, but he's come in critical care, but he's come to acquire the belief, or in nephrology. Let's pick any field you want. The program actually, with his supervision, should be able to render a more accurate diagnosis, and he uses it, and it's wrong. So, of course, if Nita were practicing in the United States, we'd have to sue him, you see, because we sue everybody all the time when this happens. On the basis of what would one file the lawsuit? In legal theory, this is where I'll need some help. There are two main kinds of malpractice. One of them, or you could bring the suit. One of them is negligence. Namely, Dr. Nita, you should have known better. You're a human expert. You're entitled to use your tool. However, you should have known when it was wrong. So it's what's called in the law learned intermediaries. Under a different name, it's what the AI community has come to call physician in the loop. Okay. If there's a bad outcome, is it fair to blame the physician who relied on a machine because he or she was compelled by rationality to do so. In the other direction, you might sue the vendor or the manufacturer, not under negligence, but under the legal theory of strict liability. Namely, whoever wrote the computer program or the algorithm or the data set or the box that they were in, they're the ones who made the mistake on which Dr. Nita relied. Whom do you sue? And that, I think, is a really interesting question at the seam of accountability and responsibility, a major concern in moral philosophy. We are free agents in a world when we use a tool of any sort. To what extent are we required to be able to explain the tool completely, to be able to be confident in its use, to be able to certify we're adequately trained to use it in the care of other human beings? And so your question, Nita, is really good and really provocative. And I think what it is, the best news is, I think it is a call to funding agencies to give the ethics community a lot more money to study these questions.
Thank you, Professor Goodman, for the answer. Do we have more questions? Anyone? Let's
Well,
see.
so
Luana had a comment. I think I'll read it right here.
Yeah, I can also just say it out loud, I think.
Go ahead.
Yeah. So first of all, that was really great. I think the first question, I'm not sure what you think about it, but I think I've read some of your work, which indicates that you would think that there is a moral obligation of physicians using AI to improve their recommendations. So I would like to hear that out loud, at least, because it's not clear for me that this is a duty. This actually, you say it many times, it is a tool, but other people are saying that there is even a duty to use it in order to improve their health decisions. And secondly, the question was about responsibility, and you just named the two paths that we could take on cases where there is malfeasance. And for me, there is a joint liability between the manufacturer and the physician, because of course the manufacturer put the algorithm in the world, and in the face of very unstructured data, which is the case for health data in many situations, in many cases, and the physician chose to use that kind of system and that tool. So for me, it's clear that they both have had the will, and there is a clear connection between the result, between their actions and the result, which is the malfeasance. So I'd like to hear what you think about that also.
Wonderful question. Thank you for that. It's a hard question. I didn't want any hard questions today. I wanted today to be an easy day with easy questions. I believe that clinicians, physicians, nurses, and others have an uncontroversial moral responsibility to know which tools will improve their practice. And if there's evidence the tool improves the practice, then it becomes blameworthy not to use it. However, what I've also argued for is and in fact, I think it was on a slide when I was in Porto Alegre last, what I've argued for is what I've called progressive caution. Not a particularly profound phrase, but one which basically says we have a duty to make these assessments, and we need to do so in a way that is measured and careful and cautious, with a lot of oversight. And so it's not a simple duty to use the latest AI program. It's a duty to understand them better, to explore their use, to be familiar with them. If it's made available in the electronic health record, so to trial it a little bit. And at all times to continue to be trained in such a way that you will know when, for example, the computer makes a mistake. We know now that these programs will make mistakes, frank, bold-faced mistakes. They will confabulate or hallucinate, depending on what kind of cognition you think a machine has, right? They will, but in any case, it says, here's the highest ranked diagnosis. Here's the highest ranked one in chapter, but in the order of the differential diagnoses, it's missed something in the literature. or it's ranked the top 1 second, or something like that. In other words, we're not confident enough in their reliability for me to be comfortable saying you must use this tool now. I think what you must do now is, and what institutions must do, and what vendors must do, and what governments must do, and what professional societies must do, is be looking at this with ever increasing granularity to try and understand how these programs work and what is an appropriate use and who is an appropriate user. That's a wonderful question, Alina. Thank you so very much for that. I hope I answered it.
Aline, you have the floor.
Thank you. Thank you, Kenneth, for your presentation.
With Luana, I'm sorry. I thanked the wrong person because I saw your face.
Luana is here also. You can say thank you to Luana.
I apologize.
Got it. I have a question. Not a question. I'm trying to develop a thinking. So we're gonna follow. I'm asking you to follow with me. The practice of thinking.
I'm with you.
Something that highlighted for me on your talk was about evaluation and how to filter information, right? We say a lot about all data. If you have data, it doesn't mean good data. I need to filter and contextualize it to see if they are applied or not. We do that in research, right? And but the difference, I think that is the question, the importance of creativity for research, analysis, and decision-making. Because if I have a different reality and I have the same information, I'm going to produce different results. So 2 people, for a simple example, if me and you were drawing a house, we're going to do different houses. We're going to put windows in different places and doors in different sides because we are different people and constructed differently. And that is something that the machine can do. What machines do is to universalize, normalize stuff, or generalize. So what is the importance of connecting informations to a different perspective of the world? So the difference between machines and humans.
It's another really good question. One of the points you make that's really important is we know now that the notes that our colleagues write in the electronic health record, with all due respect, are sometimes not very good. They're not very accurate. There's a lot of copying and pasting from day to day between doctors. We know that some of them are just badly written. They use a lot of acronyms, which sometimes are ambiguous, right? My job requires looking at a couple of electronic health records, and I find the notes to be uniformly bad. They are bloated. They're full of information that is inconsistent. It seems like things go back and forth depending on who has copied and pasted what. So the day you take a slice of that, depending on how often the database is updated, you're going to get, by definition, stuff that's wrong. It hasn't been corrected yet, or was corrected, but you didn't see the correction, right? So that's one grave problem I think we face. I'm concerned about the quality of the data that we're using in the first place, which is why some people, by the way, and you raised this point tacitly, the use of synthetic data sets or digital twins in the context of this. Let's get something that we know to be accurate, or we know to be, doesn't matter whether it's accurate or not, it was based on, well, we're going to infer that it's accurate because we were able to check that it corresponded to the world, the actual world, right? Once again, no comfort for relativists here. And if we're able to do that, why, then it seems to me we will have increased confidence. But like anything else in the world, you make a decision based on how confident you are, in the reliability of the evidence you're using to make your decision. In the practice of medicine, or in the practice of selling shares in the market, or in developing curricula for children, or in the context of law enforcement and so forth. We need to be really careful about this, lest someone accuse us of, yeah, how about mandatory moral enhancement for children? If we could predict, if only you were to do genetic engineering in children to make them morally superior, why they'd be good adults for the rest of their lives. Right? And I say, that sounds like a reductio, not a real argument. There's no one would seriously argue for biologically modifying children for their future behavior. I see the time. Nita, thank you so very much for including me here. This is a very, and others for being here. Once again, thank you. And I don't have a cup. I do have this to salute our collaboration, the long-standing collaboration between our institutions. Obrigado.
Thank you, Professor Kenneth Goodman, for the lecture. And we'll go right next for the next lecture with Professor Claudia Passos Ferreira. Professor Claudia Passos Ferreira is an assistant professor of bioethics at the NYU School of Global Public Health. Professor is also the lead investigator of the project What Do Theories of Consciousness Predict About Consciousness in Animals, Infants, and Machines, funded by the Templeton World Charity Foundation. The title of the lecture of Professor Claudia is A Pluralist View of Moral Status, Non-Humans and Artificial Minds. So, Professor Claudia Passos, the floor is yours.
Ok, obrigado, James. Bom dia a todos. Obrigado pelo convite, Nitamar. Bom ver caras familiares, Sinara, já vi que está aí na audiência. Bom, I will switch to English because I know the event is English, but I wanted to open my talk with some Portuguese remarks. Okay, so I don't have a slides because this is really fresh material. I'm still thinking through those issues. I would be very happy with any type of objection you have or clarificatory question that would help me to develop this project. So last year in this same event, I present my work that I was trying to develop a methodology that comes from infant consciousness and could be applied to animals, non-human animals, and artificial minds. So in that talk, I was interested in investigate what kind of evidence we have for consciousness in artificial minds, and whether other methodology might help us, and whether understand how our consciousness emerged during development, if this would help us to make some predictions regarding implementing some capacities in those artificial systems, and if this would help us to predict whether they will become conscious or not. So I'm just saying this because I want to tackle this issue in this talk. So my talk presupposed that those artificial minds might develop in the future consciousness. So, and if they develop consciousness in the future, the issues about moral status, that is something I just said in the very end of the talk last year, would be a relevant issue. So what I want to do today is start from these issues. What are the moral consequences of developing conscious AI systems? And I'll talk a lot about conscious AI system, but this would apply some of the discussion on moral status regarding artificial minds might apply for some cases, some non-human animal cases where we are not sure if the system is conscious or not, like fish and bees, but also apply to cerebral organoids a kind of artificial biological systems that you might develop in the future. Okay. Okay, so in my talk, I will address whether our current notion of moral status can give ethical guidance for future AI system in case they develop certain complex capacities in order to avoid, if this notion of a moral status to help us to avoid treating artificial entities wrongly, if you think that the capacities they develop deserve attribution of moral status. So numerous discussions have arisen regarding the moral status of AI and whether we should develop conscious AI. I think those issues regarding AI safety, whether the question about if we should or not develop them are relevant questions, but I won't discuss this question. I'm not concerned, okay, if they develop certain kinds of capacities, what kind of moral state, if they deserve moral status and what kind of moral status they might deserve, okay? We might decide that it's not a good idea to develop conscious AI, and we might have good reasons for this, but given the current development, we might develop in the future. Okay, so one word in this debate is whether our current notion of AI that takes consciousness as a central value could lead to many mistakes regarding which creatures have conscious states and incorrect predictions regarding who deserve moral status. So the question is whether consciousness perceived that has been a central feature for grounding moral status in the discussion of moral status for human beings, if this is a good guidance in the other cases, in the no-human case, and in the human involves artificial minds, cerebral organoids, and some borderline cases of non-human animals, okay? Some have been arguing we should abandon the idea of consciousness as necessary for moral status and adopt a less demanding view, what would result in a more inclusive moral practice, okay? So if you abandon the idea that consciousness, that moral status should be grounded in consciousness, maybe you have a more inclusive notion, and this inclusive notion will result in a more inclusive practice regarding which creatures deserve moral status. So recently, Joshua Shepard has advocated for such view. He published a paper on the American Journal of Neuroscience that I think it's a relevant paper for this discussion. So he argues against this, what he calls consciousness-based approach, where consciousness grounds the moral status. And he thinks that in the case of non-human moral status, we should abandon the idea that consciousness is necessary for some degree or level of moral status. So he argues that the judgment that consciousness is necessary for moral status is not secure to developing policy regarding non-humans, and that the consciousness-based views will result in those wrong policies, wrong way to treat those non-humans. So he proposes that our policies should be responsive to moral status in the non-human cases, and it should take seriously that other features might ground moral status. And he proposed the idea that some psychological features that are independent of consciousness would be sufficient for moral status. So his argument posits two theses. First, that consciousness is not necessary for human moral status. And second, that what would ground moral status should be those psychological features. So certain psychological features alone can confer the relevant non-human moral status, okay? So I will argue for a kind of pluralistic view of moral status, which still confers moral status, but also other psychological features will confer moral status too. What I have in mind that the other psychological features that might confer moral status is agency, intentionality, and metacognition. And we know that those psychological filters can come apart from consciousness. I might be capable of agency and intentionality and monitoring my actions, but doing this completely unconsciously. So what I would try to do is try to develop a view that that is on board of some of the criticism Joshua Sheffers is addressing to the claim that consciousness is necessary for moral status. But I want to develop a view that consciousness still has central value, okay? So psychological futures confers moral status, but if the creature is conscious, the creatures might deserve higher moral status than the creature that just have those psychological features. So in my account, consciousness has still central value, okay? But I will agree with the criticism that Joshua Sheffers and others, but he has articulated this in a nice way, I think, is addressing for the consciousness-based views, that other features might also confer moral status, okay? So my account will be consistent with the rejection of the necessity claim that consciousness is necessary for moral status, but it still will give central role for consciousness for moral status. Okay. So I will consider that Sheffers has addressed the right criticism, but constrained a lot what are the central values for moral status. Okay. So before I discuss those two views, the consciousness-based view and the psychological-based view approach, I want to just give some definitions, okay? So definition of moral status that I have in mind, but I think it's very common in this literature. I'm not proposing something, I'm just incorporate some very common notions of moral status. So the definition of moral status I'm working here is an entity has moral status if this entity counts morally in its own right. That is, it is permissible and impermissible to do things to this entity for its own sake. So in this sense, the entity's interests matter morally. So there is consensus that human beings have a sort of moral status. So what matters for this discussion here, and so in the case of human, you think that human has full-born moral status, so humans' interest matters morally. So what I will address here is how this notion, the definition of moral status, might be attributed to other cases, okay? So I'll set aside the human case and I'll focus on the non-human moral status, okay? So in particular cases where we have a disagreement, as I mentioned before, fish and beans, and the case where we still don't know if the creature will develop moral status or not, like the cerebral organoids and artificial systems. Just a caveat, this claim is compatible with the idea that those creatures might matter for instrumental value. Okay, so you think that maybe those creatures have value because it matters ecologically. Okay, but I'm interested if what grounds moral value and moral status in the sense for the creature itself. Okay, so I'm not denying the more ecological claim that those creatures have moral value for other reasons, but my talk will address this specific. So what grounds moral value for the creature itself for its own sake? Okay. Okay, so the consciousness-based view, as I said before, but just want to formulate more precisely. It's the classic view where phenomenal consciousness and for phenomenal consciousness, I mean subjective experience that involve our capacity of feelings to have a phenomenal experience, or in other words, qualia. So the best way to sell this is the capacity of feel pain and suffer, okay? So the consciousness-based view approach will say, okay, if the creature suffers, if the creature is capable of feeling pain or pleasure, these creatures matters morally. And this is what grounds moral status, and this would be necessary for moral status. So there are many ways to formulate this claim. In certain approach, consciousness is necessary but not sufficient. In other approach is necessary and sufficient. Other ways to make this claim is consciousness is necessary and sufficient, but other things are necessary and sufficient too. Maybe well-being matters, but I'm not concerned about all the flavors that this consciousness-based approach can have. I'm much more concerned with whatever account has this ingredient that consciousness is necessary for moral status. I want to address if this would be the right view, okay? So I'll set aside all the flavors that account can come. So one way to reject the idea that this consciousness-based view is proposing a different theory of consciousness that rejects the idea of phenomenal consciousness. And there are many approaches that have been developed in this sense. So one current approach is what we call illusionism, illusionist theories of consciousness. So consciousness is not what grounds moral value, because actually consciousness is an illusion. So what matters is not consciousness, but it's something else. So I will address this kind of way to reject the necessary claim. And I will say how this way to address the necessary claim is the wrong way to reject the necessary claim and propose something else. Sorry, there are many steps in this argument. I'm figuring out that probably I should just have to circulate a handout. That would have been better. Okay, so what the illusionism says. So the illusionist approach is the view that consciousness does not exist in our world. Maybe can exist in a different world, but not in the world we live. Rather, what exists is a belief that consciousness exists, and this belief is sustained by a certain illusion that is created by our mind. So actually, we think we are conscious creatures, but actually we are wrong that we are conscious creature. We just make a mistake, and this mistake is a kind of illusion that our cognitive structure created. So as Keith Franks articulates, he says, our sense that there is something that it's like to undergo conscious experience is due to the fact that we systematically misrepresent them as having phenomenal properties. So we attribute these special things to our consciousness, but actually is just an illusion. And what matters is our cognitive structure that gives rise to this illusion, okay? So one consequence of this view is to deny the consciousness-based view approach. So if you were wrong about our consciousness, we are wrong about the idea that consciousness is the ground for moral status or confers value to the creature. So one consequence of adopting illusionist view is that the truth of illusionism would imply that consciousness lacks intrinsic value. So we'll have to reject this view. So if illusionism is true, what confers moral status are not phenomenal properties, but some have been claimed that is a kind of quasi-phenomenal properties. Okay, so what confers moral status would be something else, something that gives this illusion. Okay, so assuming illusionism, the relevant question regarding moral status becomes which entities possess quasi-phenomenal properties. So we just replace the question, which creatures has moral status, which creatures are conscious and have moral status, to the question, which creatures has quasi-phenomenal properties? Which creature has those illusions? And is those the creatures that have those illusions are the creatures that have moral status? So if you want to decide in the illusionist perspective who deserve moral status, we should ask which entities possess quasi-phenomenal experiences. And if this is the case, we can say illusionism is not orthogonal to the moral status question. You can still be concerned with the moral status, but it will change the question you ask. You'll be searching not for creatures that are conscious. We are searching about creatures that are has quasi-phenomenal property, or creatures that have those illusions. So we'll focus in what some have been saying, the quasi-phenomenal properties that come from moral status. So, however, I think that there is a challenge for this view. If we adopt the quasi-phenomenal properties view, it is unclear whether we are tracking any moral relevant property for us. If phenomenal consciousness is indeed an illusion, the question here is, why should I care about these quasi-phenomenal properties? Okay, so if it's just an illusion, it seems I should not care for this. So why this would confer, why an illusion would confer moral value for any creature? Okay, so the challenge I raise for this view is we might not end up with a good guidance if the guidance is this quasi-phenomenal property. And I'll make an analogy that my rejection of this idea might become more clear. Okay, so consider an analogous scenario. Consider the case of witches. Witches in Portuguese is bruxas. Consider we are living in a scenario with witches. So people used to think that witches, the bruxas, were evil and should be burned at the stake. We thought that vamos queimar as bruxas na fogueira. Then we discovered that the property of being a witch is an illusion. But suppose we discover that there is a quasi-witch property that generates the illusion of which women are witches. So, for example, imagine that those properties are women with dark hair, with certain personality traits that make people think she is a witch. Okay. So in this case, this is an illusion, but these are the traits that generate the illusion. Should we care about those quasi-witch properties that generate the illusion? Should we organize our lives around those quasi-witches and burn the quasi-witches because they generate those illusions? I don't think so. If illusionism about witches is true, our practices about witches are bad. We should not burn them. We should not try to save them with quasi-witch properties. So, and you can apply the same analogy for the quasi-phenomenal properties. We should not try to save those quasi-phenomenal properties just because it generates the illusion of consciousness. So, if there is something else that grounds moral status, it's not those quasi-phenomenal properties, because they're just generate illusions. And as in the case of witches, we don't want an illusion to guide our practice of who deserves moral status and what kind of treatment those creatures might deserve. So I think the illusionist can still have other types of way to hold the idea that's not just consciousness that grounds moral status, but they can replace this for a different idea. So even if illusionism is true, it's not clear if we should be committed with the idea of those quasi-phenomenal properties that would confer moral status. it can be something else that matters morally. For example, an alternative perspective could adopt the idea that what matters for moral status are the psychological features that those creatures have, okay? And those psychological features might have intrinsic value. So they can adopt the view that I said in the beginning, that those psychological features that those creatures have are the ones that grounds moral value. What are those psychological features? Agency, intentionality, self-monitoring. Self-monitoring is a type of introspection that you might have, but you might not be introspectively grasping your conscious state. You might just be monitoring your mental states, okay? So one way to reject the necessary claim for consciousness as a grounding moral status would be to replace this with a different view that Joshua Shepard called the psychological based view. So it's not another type of property that I will put in the place, but just some other kind of psychological feature that those creatures might have. Okay, and I'm sympathetic with this view. I just want to reconcile this view with consciousness still having central value. But let me say a little bit about this view. So in this view, psychological features hold moral value. Okay, so agency, intentionality, self-monitor, introspection, as I said before, would be sufficient in this view for relevant non-human moral status. And we should not construct an ethics centered on consciousness, we should construct an ethics based on those psychological features, okay? So whatever creatures display those psychological features, those creatures deserve certain type of moral status. On Joshua Shepard's view, is deserve moral status, period. In my view, it deserves moral status, but if a creature on top of those psychological features have phenomenal properties, those creatures will have more moral status. So now I go for my view that I'm calling pluralistic view because it's an attempt to accommodate the intuition that consciousness is not the only thing that confers value, but is still have a central role. So my view is aligned with the criticism, but my argument will support more pluralistic view. So both things, the psychological features and consciousness confers more status to creatures. So all those properties, they have value. But one consequence of my view is, imagine you have a case of a zombie, okay, a philosophical zombie. Imagine you have a case where I have all the psychological features, but I'm a zombie, I'm not conscious, okay? I don't have consciousness. I think this creature, compared to a conscious creatures, if they have the same psychological features, but one have consciousness and the other one does not have consciousness, I think the conscious one have higher moral status, okay? So if you have to save a zombie that has the same type of agency, intentionality, and introspection, moral state, the same psychological architecture I have, but this creature is unconscious, and you have a conscious creature, you should save the conscious creature, okay? But I'm not saying that the zombie creature deserves no moral status. I think still deserves moral status. And we should not kill those creatures without purpose, okay? So psychological features still have moral status, but a corresponding creature that are conscious to will have higher moral status. So I argue that while psychological features might have some degree of moral status, conscious has higher degree of moral status, okay? So conscious might not be the only source of value, but is required for value. So the way we make those distinctions is because we are conscious creatures. And those conscious states, sorry, I'm just moving my hands and some some things are pop up in the screen. Okay, so this view is consistent with the rejection of the necessity claim, but it still grants consciousness a more central role in moral status. So what are the ethical implications of my view? If you have a consciousness-based precautionary, I think still a consciousness-based precautionary approach is relevant. If you have a creature that is conscious, I think we should treat those creatures differently. But in a pluralistic view, if the creature has some psychological features, we should treat those creatures in correspondence of those psychological features. So if you have agency, intentionality, and introspection, your interest might still be frustrated. Okay? Those creatures might still have goals to perform some actions. And if you kill them, or if you prevent them to develop those or to perform those actions, you still might be morally wrong. Okay. Although if you compare them with a creature that has those conscious states, you might still think that those conscious states might value more. My accounts still don't give good guidance for a more problematic scenarios. I still have to figure out what to say about those problematic scenarios. So imagine you have a country full of billions of zombies that have all the agency and intentionality and everything. And you have a choice of either kill this entire country or save one conscious creature. I don't know, one fish that is conscious. Okay, so would those cognitive capacity or psychological features value more if you compare, if you aggregate those, all those psychological features? You don't have good answer for this question, so I'm just put on spot that there are problems for the view that might still have some maybe interesting things to say, but I think this view still have some guidance for what matters now for us. So what matters now for us? We want to know whether language models in the future, in the near future, if the capacity they develop would ground moral status or not. And I think my view give a better guidance than a just psychological based view. Why? So imagine you have two cerebral organoids. One have some psychological features that you think confer moral status, and the other one have some psychological feature, but has also consciousness. I think the cerebral organoid that's conscious would be treated in a different way than, or at least would have higher moral status than the one that just have the psychological features. So I think it's still matter for us, this distinction, when you make some moral decisions, okay? Although I might think that if you in the future create a cerebral organoid with certain psychological features, you still have to think that we'll have to treat them differently as an inorganic matter that has no psychological features that matters for us. And the same is right for large language models. So for instance, there is a paper that just came out arguing that the current large language models, they are kind of language agents. Should we attribute, oh my God, now the feature of, I'm not doing this, just my hands. Maybe it's the large language models are doing this in the Zoom meeting. Okay, so imagine those, should we treat them just because they have those psychological features of being an agent as we would treat them if they have consciousness? I think no. I think there is still matters for us if the large language models are conscious or not. So I stop here. I think I said a lot. Okay, thank you.
Thank you, Professor Claudia. On the list, we have already Professor Nitamar. So let's get right to it. Professor Nitamar, you have the floor.
Thank you very much, Claudia. This was extremely interesting and original. Let me ask you a question, perhaps more of clarification, to request you to clarify a point, especially regarding the usage of this suffix quasi or quasi. If I understood your takes on what would be a quasi-phenomenal conscious state, I understand that you are assuming on the one hand that perhaps consciousness of others cannot be observed, or like when you make a case for zombies-like situations or scenarios like David Chalmers talks about. But on the other hand, I also had the impression that you maintain a case for phenomenal consciousness, right? As we can infer also from your other studies on children's phenomenal consciousness. So my question is, when it comes to moral conscience or moral consciousness, it seems funny that if you understand that we are, or if you are assuming that we cannot assign consciousness to robots or machines, precisely because even if they are behaving in a morally acceptable or commendable way, we say, well, this would be the way moral machines should behave. We still, I feel, at least I have the impression that would refrain from assigning them some kind of a moral consciousness, right? So where does the quasi-phenomenal consciousness play a role there? I just want to make sure that I understand how far are you going in terms of avoiding to assign consciousness to AI-based systems or robots, and on the other hand, to assign consciousness and phenomenal consciousness, especially to infants and human kids. Thank you.
Yes, thank you. Excellent question. So I would need another talk to discuss how we attribute how you can infer consciousness in others. But I will just say this very briefly. Maybe my answer won't be as deep as this subject needs. So you're right that, and in my discussion on consciousness in infants, I address the problems of other minds. How can we know if other creatures are conscious? So some would hold a very skeptical view that I can only know about my own mind. Kind of solipsistic view. The only conscious I know is my own conscious. I don't hold this view. I think, although I might not know what you're thinking now, I think I have some evidence that and the group of things I can put together to make the evidence you're conscious, for me is pretty strong and pretty convinced. So I don't know, you are made for the same biology I am, you have the same history, you were born from another human and you developed. I don't think you're a robot. I don't think someone during the night replace the biological Nita for the robot Nita. So I think who is there is still you and not a robot. But imagine I open your brain and, oh my God, Nita is not made by a biological brain. I just discovered that is this robot that is interacting with me all the time, just performing the same actions and behave as Nita and with the same personality, and the same voice and same. So then, and if maybe if you're not made by biology, I would decrease my confidence that you are conscious. But then I could say, okay, imagine that in the future, imagine that in the future, we can have robots that are conscious, and then say, okay, Newton might be conscious because nowadays we have robots that are conscious. Then you ask, okay, how you know that robots are conscious? First, if you think that consciousness, that is a requirement for consciousness, be made by biology. So maybe you have the predictions that robots will never be conscious, only if you can reproduce with the biological matter. But then the cerebral organoids might be one of those cases. Okay, the cerebral organoids has the biology. So maybe in the future we have cerebral organoids that have consciousness. And then you can ask the question, oh, how can you know the cerebral organoids are conscious? The type of consciousness we know is the one that has perceptual systems and interact with the environment. And the cerebral organoids is this isolated, this brain in the vat. So you can still be skeptical about this. So I don't hold the biological constraint claim that you need biology. I think we might be able to, if you have the same isomorphic structure, we might be able to have an artificial brain in the future that might gives rise to consciousness. So I don't, but if you hold those views, you might be skeptical about any possibility, even for cerebral organoids or but even if I don't have those constraints of the biology and the interaction with the environment or having a body as a constraint for consciousness, you can still ask the question, how you detect if those creatures, because I can have a system or a cerebral organoid that is a brain of that, but it's conscious, well, how I can detect this? And the same question holds for the machines. So, okay, the machine has the same isomorphic structure as my brain, the same circuits. Are this system conscious? I think that some evidence that we have been used in the case of animals and infants, there are cases you don't have verbal report, might be a good guidance. That consciousness might require some types of neurofunctional connectivity that those creatures display to know that those creatures are conscious. I agree with you that behavior is misleading, just behavior. But I also, and in the case of cerebral organoid, there is even no behavior to be identified. But in the case of artificial systems, AI, behavior might be misleading. And even in infants, behavior might be misleading. I might have an infant that is moving their eyes, but they're moving their eyes conscious. A baby that is crying, is this baby actually feeling pain? So behavior is misleading, but I think if you have a behavior like humans, okay, so if the behavior is compelling, if you have the same neurostructure that would give rise to consciousness in adults, I think those things put together with theories of consciousness that gives us some prediction, and then I didn't say anything about theories of consciousness, the quasi-properties. I think you might have a good case. The quasi-properties, and my answers became very long, became a second talk. I'll just say very brief on quasi-properties and quasi-properties, and I will go for the other question. So the quasi-property comes from a theories of consciousness. There is one theory of consciousness, illusionism, that defend the illusionism coming in different flavors. There is one perspective of the view that says what matters is not phenomenal properties, but a kind of quasi-phenomenal properties, these illusions we have. So we are not conscious creatures. We don't have phenomenal consciousness. We just have the illusion that you have something special, but this is not special at all. It's just an illusion that our cognitive architecture creates, or introspective architecture creates. So this view, we could make the same idea, the same consciousness-based model for moral status. You could create, and some theorists have proposed this, this quasi-phenomenal properties based view for moral status. So what matters is not the consciousness, is the quasi-phenomenal properties. And I think this failed because I think those quasi-phenomenal properties might not have any value. If it's just an illusion, what might matter might be the cognitive architecture of the type of cognitive architecture we have. So why not just reject these quasi-phenomenal properties and work with either you believe in phenomenal properties or what matters. If you don't believe, what matters just a cognitive architecture. I think those quasi-phenomenal properties plays the same role of quasi-witches properties. That is kind of illusion that doesn't matter morally for us. Okay, sorry, I was a very, very long question. Sorry for this very long question. I promise I will try to be short.
Thank you, Professor. Sinar, you have the floor.
Thank you very much, Claudia. I'm just it's just a clarification question as well, you know, because if I understood you very well in your model, the questions of the psychological features are essential, yeah, for you in your definition. But then I'm not sure about what exactly, which psychological features do you have in mind, yeah? Because, okay, I understand, okay, I would agree, I would be, you know, tend to agree, you know, there are some psychological features but which are these, you know, these psychological features, you know, that you, and just a second, and it's just a question of clarification as well. If I understand, if you understood, if you have a consciousness plus this psychological features, then you have moral status, yeah? If you have consciousness, only consciousness, you have moral status. But if you have just these psychological features, you don't have a moral status. This is not clear for me. I mean, consciousness is still necessary to guarantee moral status.
Yeah. No, very good question. So it allows me to clarify. So before I say about the psychological features, I will clarify the view. So one view, so the consciousness-based approach is what matters is consciousness. If you're a conscious creatures, you deserve more status. If you're not conscious, you don't deserve more status. Okay, you can have instrumental value or ecological value, whatever, but you don't have. The psychological-based approach would say, let's get rid of consciousness. It's too complicated. There are cases you don't know. It's a little bit what Anita Mar was saying. Oh, there are cases you just, how can you know it? Just so for this view is, as you don't know, you might end up with a very wrong policy. In the cases you're completely sure you have the right policy, but in the cases you don't know, you end up probably doing some wrong predictions about that creature. So let's get rid of consciousness. What matter are the psychological features that those creatures have. I propose something in the middle. I'm saying, okay, consciousness is not necessary. Some creatures might have more status just because of their psychological features. But consciousness is still have higher moral value than just psychological feature. So psychological features have moral values, but if the creature is conscious, this creature has higher moral value. Okay. So I'm rejecting the necessity claim in the sense that I'm saying that creatures with just psychological features that we don't know if the creature is conscious or not still have moral value. But if you add consciousness to the picture, if this creature is conscious, this creature matters more morally, has higher moral status. Okay, so it's a kind of hybrid view. I'm calling pluralist, but maybe should be a kind of hybrid view. So how we define? I think you raise a very good point. So it's very hard to know which psychological features matters. So it's a very broad idea of which psychological features would matter. Maybe tomorrow say, oh my God, I forgot one psychological feature that might matter. But I think there are some psychological features that many people would be on board that is relevant. So usually the creatures that we are kind of borderline, we don't know if the creature is conscious or not, are creatures that are capable of agency. They are capable to navigate the world. They seem to monitor their own system. They have this kind of self-monitoring. So let's get fish, that there is a huge debate nowadays with fish, if fish are conscious or not. So the question is, fish seems to move. They move around their environment. They have goals. They seem to monitor their own states. You can also think about bees. They have intentionality. They have intentions. They go to certain areas to search for food. So does it matter if they're conscious or not for them to have a moral status? I would say no. I think they should have moral status, even if you're not sure if they're conscious or not. So in this sense, I agree with the psychological features based view, that those psychological features matter. And then you could say, oh, but if the creature has other kind of cognitive capacities, for instance, the large language models, at least they are not moving around. They're just doing cognitive actions. So you could consider them, that some people are saying they are language agents. They are doing speech acts or mental actions, and this should count as moral status too. So you cannot just destroy those systems. But I still think that if in the future we create the same system with a consciousness capacities, the system will have higher moral value. Yeah, but I still don't have a very definite approach of what are the list of psychological features that should matter. I might be leaving out some very relevant feature that tomorrow. So this feature, but what I want to say is, so maybe what matters as a more broad distinction is, if the creature has those psychological features but don't feel pain and don't feel pleasure, this creature still matters. So I don't want to ground the moral status just in a kind of affective consciousness. Then the only thing that matters is if I feel something or not.
Great, it's clear now. Thank you.
Thank you for the question.
Thank you, Professor Claudia. Do we have any more questions, or should we close it? Anybody? I have time for maybe one quick question.
I have a non-philosophical question to Claudia. Please, Claudia, insist with Professor Chalmers that you guys should come over in May, June, or whenever.
Again? Say again?
Yes, no, I'm just saying, would you please insist with Professor Chalmers that you guys should come down here sometime in May, June, or July? David himself sent me an email and he said, all right, I'll try to make it in May. Well, whenever you guys get a chance to work on your agenda, whenever you guys want to, for instance, take a trip to Rio, you come over to Porto Alegre for a couple of days, and we're going to be able to make this invitation, because there are lots of people here really hoping to have you both visiting our program, and we have this stipend for this.
Yeah, no, thank you so much for endorsing this invitation, and we'd love to go. It's just like, because things happens in life, and then when you see our lives completely absorbed by all sorts of things. But I will reply your email about May, June, July. But I promise, if you don't go this May, we'll go sometime in the future.
So thanks everybody for the presence, for enjoying
Thank you very
these
much
lectures.
and for organizing this.
Thank you, Professor. So we now close this session, and then later we reunite for another session. So thanks, you guys.
Thank you, William. See you guys around. Bye-bye. We
Bye.
resume at 2 p.m. Brazilian time.
Yes.
Thank you, William, for a wonderful job.
Thanks.
Thank you, Professor.
Bye-bye.